Labrum is cartilage that prevents shoulder dislocation. Labral tear may occur with throwing action. Arm elevation with resistance will create pain. Arthroscopic labral repair can be done when pain is great. Labrum is torn when shoulder dislocates. Recurrent shoulder dislocation is treated with Bankart operation. Anterior labrum is repaired. Calcific tendinitis can create shoulder pain. Toothpaste-like calcific material is formed inside rotator cuff. Patients complain of great pain when inflammation is severe. Treatment options are medication, injection, and extracorporeal shockwave therapy. Arthroscopic calcification removal is performed if conservative therapy fails.